discuss this evening is this. Most of you are sitting here for one main reason. There's something in your life that you either would like to be able to do but you can't, and back pain or neck pain is bothering you from doing that, or there's something that you have to do that you don't want to be doing, maybe walking with a cane or having to get assistance to get your clothes on. We've had people say that frequently. Whatever that is, I hope that we find some answers this evening, and I'd like to have the opportunity to share some information. For those of you that haven't met me yet, my name is Dr. Ray Nannis. I'm a chiropractor. I've been practicing chiropractic now for 15 years, and we've had spinal decompression in our office for a little over 2 now. So we've got quite a lot of experience, and I hope that we can find some answers for everybody. Most of the people that have come into my office, I'm usually not their first doctor when they talk about back pain. They've been to other doctors. Some have actually had surgery. Some were scheduled for surgery just before they came to the meeting. Is there anybody this evening that actually is scheduled for surgery right now? Okay, good. That takes a little pressure off. Otherwise, we're figuring out how to get you in tomorrow. Other than that, the big point is that many doctors are today arguing about what is the best procedures. As our technology advances, we're finding that there are more and more expensive procedures, and the argument really is, are these expensive procedures something that's paying off? So there's a raging debate whether or not a spinal surgery, spinal fusion, is actually overused. The American Society of Spine Philadelphia officials said that the question about the surgery has been raised by the doctors themselves. The rising cost and growth in the number of back surgeries is a good example why healthcare is becoming so much more expensive. But the outcome from surgery is actually uncertain. And unfortunately, what we're discovering is that there's almost an 80% failure rate from low back surgery, even though it may cost close to $100,000. So as costlier procedures start to occur, the question is, are they the right thing for you? And I actually had a patient that came in here with one of these discs, and what this is showing us is an artificial disc, and it is a more modern procedure where instead of totally fusing the spine, it allows you to have some range of motion still. I had a patient that had one of these come into my office, and although he's not a candidate for decompression once there's metal inserted in the spine, he was actually in more pain than anybody I think I've ever seen. And what had happened is one of the screws from the surgery had come loose and was laying up against the spinal cord itself. And MRIs couldn't see it. We couldn't see it on x-rays. They found it on the 3rd MRI because we've been trying to figure out why he wasn't getting any better. But after the surgery and after all the scar tissue, that was one of the major reasons. Surgery is not the only option, and that's really what we're here to discuss tonight, is for people that are suffering from severe and chronic low back pain. Surgery isn't the only answer, and I am a member of a group called Spinal Aid Centers. It's a national franchise. However, what I want to stress is that what you're getting a local office. It's just something that we've added into the office, and the advantage of doing that is it allows me, if I need, I have a network of other doctors, because I don't have every answer. I'd like to tell you that I know everything, but there's nowhere close to that. I don't have every answer for everybody, but if I can't, I can find somebody who will have that answer. So that's one of the major advantages of having the network of doctors. Patients come for the relief of pain, but most importantly get their life back, and that's what I started this evening with, and that's my main priority. One of the first questions that I ask everybody on their first consultation is, what is it that you can't do, or what is it that you would like to be able to do, or what is it that you are doing you don't want to do? Because what I care about isn't as much the symptom, I care about how it's impacting your life. Because I've known people that have dealt with symptoms for a very, very long time until it becomes an interference in their life. And that's what this really becomes about, is how do we get your life back and back on track? So getting your life back on track is kind of my catch term. Although a gentleman over here suggests, if you're having back problems, come to Outback or something close to that. So that sounded out pretty good. I think we're going to use that in the future. Oh. I never put together that we're meeting at Outback for back problems, so. I've only been doing this is about our 8th or 9th meeting here, so that actually worked out pretty good. What is going on, though, is we're finding as people are getting older, as the baby boomers are retiring, as the greatest generation has been in retirement for a while, what we're finding is as people are getting older, they're not just sitting in front of the TV doing nothing anymore. We have the 72-year-old, the 82-year-old, what have you, that is out playing tennis, that's being active, that's still participating in society, because quite honestly, we're going to be living longer. The average lifespan is now getting into the upper 70s, but there are people that the fastest growing portion of our society is the centurions, which are people now that are 100 years old. The question is how active, how healthy are you? And that's really what it boils down to, is becoming as healthy as possible. A herniated disc, a pinched nerves are among the most common reasons why most people might undergo a surgery. But it's always better to look at the alternatives, because once you've had a surgery, sometimes the scar tissue from the surgery actually can make things worse, and sometimes there's irreversible things from surgery. What I hope that people understand is that doing things like laminectomy, discectomies, and fusions, it's not just because the doctors, well, a lot of the reasons that we're doing more of that is a lot of doctors just simply don't know that there are indeed alternatives. There was a study that was done, and it found that most physicians don't even know about decompression, or they don't really understand what it is. So some of your doctors may not even really understand what decompression is yet. Hopefully we're doing our best that we can to educate it. It also accounts why there's so many, that the amount of fusions has actually quadrupled. A herniated disc, a pinched nerve, sciatic, can actually send pain from the back all the way down into the leg. Many times this is crippling. It can cause things like foot drop. Eventually you can trip and fall, have fractures. A lot of other problems can come from this. A host of deformities. There's a time and a place where surgery is necessary. It's not the only answer. Spinal aid is indeed giving us, or spinal decompression is giving us an alternative. And before you do choose to have surgery, before you decide to have any major medical procedure, think about it. Soul search. Think about it. Do the information. Do your due diligence, and make sure that the evaluations that you're getting and the information that you're getting actually warrants the procedures that you choose. So I hope today that you do know your options. Now, there's about 50 million Americans that are suffering from low back pain at any given time, and there's about 10 million of them that are more in a minor scenario. However, there's 40 million of these, 40 million Americans that are suffering from chronic low back problems. They're actually dealing with things for a very long time. Of the 10 million, we may be dealing with people that no matter what they do, they'll actually feel better. So they do almost anything and they start to feel better. They're going to have relief from remedies, over-the-counter medications. Most of these people never get a diagnosis. You know, they're not going to a doctor. They lay down for a day or so, they feel better. They usually have a fairly stable condition. The problem is that there are 40 million Americans that really aren't getting lasting relief. So there's a bunch of people that are suffering with these problems. Many of them have tried drugs or are on drugs on an ongoing basis. Some actually have a diagnosis. They've been to several doctors, they've got a diagnosis already, they have MRIs, they have x-rays. The problem is they're clinically unstable. Of the 10 million people we're dealing usually with sprains and sprains. These are the overexertion injuries. They have a muscular problem. It's going to resolve by itself. For most of the people sitting in this room, this isn't something that was brand new. That's what I found. You don't come out to a meeting to learn more about something that you've had for a day or two. Many times these are disc bulges, disc hernias, there's sciatica, there's stenosis, which means small hole where the nerves are going through. There's deterioration, arthritis, and the problem doesn't resolve by itself. For the 40 million pain and chronic pain sufferers, if you happen to be one of those, or if you've been diagnosed with any of those conditions, but you may still be on pain pills, that's exactly what we're here for. Some people have been told that they have to live with the pain. It's probably one of the most common things. I've had people that went to multiple doctors that were told they may not even be candidates for surgery, but they were just told they have to live with the pain. Some have gone through every pain center that you can imagine, and they're just not getting the results. They're frustrated. And what I've discovered is people aren't so much frustrated by the fact that they tried something and it didn't work, but they're just frustrated because they're giving up hope. They don't have the chance, they're not being given that chance that they can actually make an improvement.